I got up at 4:30 in the morning like I normally do. Felt fine, no problems whatsoever. The next thing I know, I lost control of my eyes. One was looking one way, one was looking the other. The right side of my face was starting to droop.
Heart rate's 85, blood pressure right now is 170/85.
I think you're having a stroke, and it's caused by blood clot.
So I went for a CAT scan. When I come back, they had pulled Dr. Barreto up on the TV screen.
Can you tell me about your past medical history? Do you have any medical problems?
I've had high blood pressure most of my life since I was a teenager. I'm currently on Benecar.
We use specialists on call. We get a neurologist, and the neurologist examines the patient. He can talk to the patient.
Can you tell me what happened this morning? What brought you into the emergency room?
I was at work and I started getting blurred vision.
Specialists on Call is a physician services company providing emergency critical care physicians to our client hospitals across the country, and we do it using video conferencing from Tandberg.
It's hard to imagine a doctor being at your bedside on a TV screen and treating you, but he did it.
Open up your eyes very big. Can you look straight up?
It's video conferencing that allows us to increase the likelihood that we are going to have a life-changing impact on a patient. Hi, Ms. Smith. At this point, what I'd like to do is a neurologic exam, if that's okay with you.
The physician shortage in this country is especially evident in the specialty groups. So smaller community-based hospitals just don't have access to those specialty physicians. We provide that access. We get the specialty physicians to the bedside within 15 minutes.
How about the other arm? Can you lift that up and hold it for 10 seconds? 8, 9, 10. It looks like you're having more trouble on the left. Would you agree?
Yes, sir.
Part of the thing for stroke is a neurologist needs to see the patient within 15 to 20 minutes.
From the moment I started talking to Dr. Barreto, I really wasn't scared anymore.
Now there's a medicine we can give you that breaks up blood clots. It's called TPA, and it's a clot-busting drug.
There is a medicine in the United States that can be given to patients with severe stroke symptoms, but it can only be given to those patients within a short window of time.
After you get the medicine, we're going to be monitoring you very closely. You'll be admitted to the ICU.
Yes, sir. And Dr. Barreto, as far as I'm concerned, saved my life.
What I want you to do is lift both hands straight up into the sky and put your palms straight up. That's it. Now close your eyes. The beauty of video conferencing, it allows me to do everything that I would want to do at the bedside. It allows me to talk to the patient, it allows me to talk to their family, it allows me to talk to the staff, and really creates that personal experience that I think sits very well with patients, family, as well as staff.
Once we're connected to the other side, the physician can see the patient. They can zoom in and get a close-up of the patient. They can pan around so that they can talk with the ED staff.
The functionality is everything that I would expect at the bedside, meaning that if I wanted to lean over the patient, look more closely into the eyes, if I wanted to step back and get a greater sense of the overall degree of paralysis, I can do that by zooming in and out of the camera. I want you to take your hands and just open and close them as quickly as you can.
We actually use our client hospitals network. We have limited to no impact on their security in terms of their hospital network. Tandberg provides not only reliability, but they also provide ease of use by eliminating most of the barriers to entry into these networks. They do extremely well in terms of support and firewall traversal and core management.
Well, Stephanie, I will tell you that on examination, you're as normal can be.
That's great, thank you.
This is an immensely satisfying way to practice medicine, and it is gratifying at this point to be proving that this is the wave of the future.